According to the American Cancer Society, 1 in every 7 men is diagnosed with prostate cancer in his lifetime, and it is the second leading cause of cancer death among men in the United States. Grilled meat, poultry, and fish are high in fat and a significant contributor to the risk of prostate cancer. Nuts and seeds, cheese, and other low-fat foods are also high in fat and a significant contributor to the risk of prostate cancer. Managing your risk of developing prostate cancer begins with being aware of your family history, recognizing the risk factors, and developing a proactive care plan. Family history is important because a male who is diagnosed with prostate cancer has a dramatic 55% chance of being a survivor if he has a family history of prostate cancer. The odds are mainly higher for a man who has a brother or sister who was diagnosed with prostate cancer. By comparison, the odds are 15% for women with a brother or sister who was diagnosed with cancer, and the odds are just 3% for women with unknown family history. According to the National Cancer Institute, 90% of prostate cancer cases are caused by a genetic imbalance of the male body that signals to the male brain the need to repair itself. Unfortunately, many men don't understand what their body is telling them and whether or not they are taking care of the necessary steps to repair their body. The prostate is made up of 4 mucoid endometrial tissue layers that are located throughout the lower intestine. These tissue layers are collectively known as the peripheral region. Within these 4 layers, the prostate contains a mixture of blood vessels and nerves. The mucoid endometrial tissue layers protect the prostate from intestinal viruses, bacteria, and debris that collects from the intestines. When it is time to repair the prostate, the mucoid tissue is replaced by a thin whitish tissue known as the converted epithelial mucoid layer. This replaced mucoid tissue is proven to be a barrier that prevents harmful substances from lingering in the prostate, thereby reducing the risk of prostate cancer. According to scientific research, what a man puts into his mouth is what his prostate will be. This means that one of the most important factors to ensure the prevention of prostate cancer is to make healthy choices regarding what the man takes into his mouth. Prostate cancer is not the result of a poor diet, but it is strongly associated with the consumption of processed foods, red meat, and the excessive intake of alcohol. Prostate cancer prevention involves reducing these unhealthy levels of food so that the body is stronger and can heal itself, without the intake of these damaging substances. Identifying prostate cancer is not easy because there are so many variations that the disease can manifest. One problem with diagnosing prostate cancer is that the symptoms can mimic those of other illnesses. As such, a doctor needs to have all of the necessary data to make an accurate diagnosis. 4 major nodes control the cadence of symptoms. They are the rectum, the prostate, the penis, and the urethra. The prostate is marked by the presence of the prostate gland, and annually, tens of thousands of men across the country undergo prostate exams. The rectum, on the other hand, is used to store stool and void urine. The rectum is also where salt dilates and urine flows during bowel movement. The prostate creates the consultant prostate, which plays a very important role in the management and progression of cancer. Once prostate cancer is detected, it can be effectively treated with hormone therapy and surgery. Prostate cancer is also sensitive to treatment and resistant to conventional therapies. The penis is a focus because it is the focus of sensation and sexuality. The penis is also where sperm is stored before ejaculation during male arousal. During sexual intercourse, sperm is released into the vagina, where the woman can place it inside her vagina and facilitate fertilization of the sperm. In many cases, only one sperm packet is released. This will result in a pregnancy, which will be painless and open tender periods. Occasionally, the sample vein or 360 sperm. Many people are unaware that the failures of some sperm may not be fecal impact and may be owing to improper or directed movement. These sperm can swim towards the urethra and carry it into the bladder. This is known as sperm urgency and is considered to be the most reliable sign that a pregnancy is impending. Because the inside of the human body morphs into that of a tube, which may be rather small compared to the ejaculating partners, many illnesses are usually triggered out of nowhere. This ends up in pregnancy more often than one would wish and for all parties. On the whole, one should consult a physician regularly and have frequent new Kermia tools tests to detect problems.